All right, let's get right into it. Today, we're talking about a true emergency, the eclamptic seizure. For anyone on the front lines, knowing exactly what to do and doing it fast can literally be the difference between life and death. So let's break down the protocol. Okay, so picture this. You're on scene, you've got a patient, she's pregnant or just had a baby, and she is actively seizing. Your mind is racing, you've got to act now. You have options in your kit, sure, but for eclampsia, there is only one right first-line drug. Do you know what it is? The answer, without a doubt, is magnesium sulfate. Period. It's not just a good choice, it's the only choice in this situation. This is the single most important thing you can do to stop that seizure and prevent the next one. So, knowing the drug is step one. Awesome. But how do you actually use it? How do you give it safely and effectively when the pressure is on? Let's walk through the field protocol step by step so it becomes second nature. Okay, your first move is all about hitting that seizure hard and fast. We do that with what's called a loading dose. Its only job to stop the active seizure by getting the magnesium level in the patient's blood up to a therapeutic level and doing it quickly. And here is the first number you absolutely have to burn into your memory. The loading dose is 4 to 6 grams. This is the dose that kicks off the entire life-saving process, 4 to 6 grams. So how do we give those 4 to 6 grams? First off, this is an IV infusion, not a rapid push, and that's super important. You're going to infuse it over about 15 to 30 minutes. Why? Because if you slam it in too fast, you can cause some serious problems, like a huge drop in blood pressure or even cardiac issues. The goal here is controlled speed to stop the seizure safely. Great, the seizure stopped. But you're not done, not even close. The underlying condition, the eclampsia, is still there, which means another seizure could be right around the corner. To stop that from happening, we start a maintenance infusion. And for that, we have our next magic number, 1 to 2 grams per hour. This slow, steady drip is designed to keep the patient's magnesium level right in that sweet spot, basically creating a shield to protect against any more seizures. You'll get this continuous IV drip going right after the loading dose is finished. Now, in the hospital, this infusion is going to run for at least 24 hours after the last seizure, or 24 hours post-delivery, whichever is later. The goal is simple, but it's absolutely vital. No more seizures. But what if she seizes again, even after you've done everything right? It can happen. This is a critical moment, and the protocol is crystal clear. You give an additional 2-gram IV bolus over a few minutes to get things back under control. Now, as amazing as magnesium is, we have to respect it. This is a high-alert medication for a reason. Too much of a good thing can be toxic. That's why constant, vigilant patient monitoring isn't just a suggestion. It's a non-negotiable part of the deal. So here's exactly what you need to be looking for. The very first sign of toxicity is often the loss of deep tendon reflexes. If the levels keep climbing, you'll see more dangerous signs. Their breathing slows way down. That's respiratory depression. Then their urine output drops, and their blood pressure tanks. Out of all of these, respiratory depression is the most immediate threat to life. If you even suspect toxicity, you have to move, and you have to move fast. First, stop the magnesium infusion. Then, you give the antidote, calcium gluconate. The dose is 1 gram IV, given slowly over about 2 to 5 minutes. Calcium works by directly fighting the effects of the magnesium, especially on the heart and lungs. Okay, we've covered a lot of ground. The loading dose, the maintenance infusion, and the really important safety checks. So let's boil this all down to the absolute must-know info you can take with you into the field. If you only remember one thing from this entire explainer, make it this sentence. This is your mantra. Eclampsia equals magnesium sulfate. The whole protocol, in a nutshell, is a 4 to 6 gram IV load over 20 to 30 minutes, followed by a 1 to 2 gram per hour infusion. Just burn that into your brain. And finally, a few practical pearls for when you're out there. Number 1, if you have a seizing patient who is pregnant or has recently given birth, you treat it as eclampsia until proven otherwise. End of story. 2, you monitor them relentlessly. You're watching their breathing, their reflexes, their mental status. And 3, always be ready for the worst. If you see those signs of toxicity, be ready to manage their airway. Mastering this isn't about passing a test. It's about being ready to save 2 lives. So what are you going to remember when that call comes in?